telehealth and virtual care have transformed from niche experiments into central pillars of the American healthcare system, reshaping how patients and providers interact, how care is delivered, and how health outcomes are pursued. What began decades ago as limited telephone consultations and pilot video links for rural communities has evolved into a sophisticated technology-driven ecosystem that spans primary care, specialty medicine, mental health, chronic disease management, and preventive services. Preventive services. In the United States, this evolution has been shaped by a unique mix of technological innovation, policy shifts, market forces, and patient expectations, culminating in a healthcare modality that is now firmly embedded in everyday life. In the early stages, telehealth in the U.S. was primarily a solution to geographic barriers. Large rural populations, shortages of specialists, and long travel times made remote consultations appealing, particularly for veterans, Native American communities, and patients living far from academic medical centers. Early programs relied on basic video conferencing and store-and-forward technologies, such as sending radiology images or dermatology photos for later review. While these initiatives demonstrated promise, adoption was slow due to high equipment costs, limited broadband access, fragmented reimbursement policies, and regulatory constraints that varied widely by state. The steady expansion of internet connectivity, smartphones, and cloud computing in the 2000s laid the technical groundwork for broader virtual care. Patients became accustomed to digital interactions in banking, retail, and communication, and expectations began to shift toward convenience and on-demand services. Healthcare, traditionally resistant to rapid change, started to experiment more seriously with patient portals, secure messaging, and remote monitoring devices. Even so, telehealth remained peripheral for many health systems, often treated as an add-on rather than an integral part of care delivery. The COVID-19 pandemic marked a decisive turning point in the evolution of telehealth and virtual care in the United States. Faced with lockdowns, overwhelmed hospitals, and the urgent need to reduce infection risk, providers rapidly pivoted to virtual visits. Federal and state governments responded with unprecedented regulatory flexibility. Medicare and many private insurers expanded reimbursement for telehealth services, allowed patients to be seen from their homes rather than designated clinical sites, and permitted the use of common communication platforms. State licensing rules were temporarily relaxed to allow cross-state practice, and patient adoption surged almost overnight. What might have taken a decade of gradual change occurred in a matter of weeks. This rapid expansion demonstrated that virtual care could be effective, scalable, and widely accepted. Patients appreciated reduced travel time, lower costs, and easier access to clinicians, particularly for routine follow-ups, mental health services, and chronic condition management. Providers discovered that many clinical interactions did not require physical presence, and that virtual visits could be integrated into daily workflows. Health systems invested heavily in telehealth platforms, cybersecurity, training, and digital infrastructure, recognizing that virtual care was no longer optional. As the acute phase of the pandemic subsided, telehealth did not retreat to its former margins. Instead, it entered a phase of refinement and normalization. Policymakers debated which emergency measures should become permanent. Insurers reassessed payment models, and providers worked to determine when virtual care was appropriate versus when in-person visits were essential. This period highlighted that telehealth is not a single service, but a spectrum of modalities, including video visits, audio-only consultations, asynchronous messaging, remote patient monitoring, and digital therapeutics. One of the most significant areas of growth has been mental and behavioral health. Even before the pandemic, the U.S. faced a shortage of mental health professionals and widespread unmet need. Virtual care lowered barriers related to stigma, transportation, and scheduling, making therapy and psychiatric services more accessible. Telepsychiatry and app-based counseling platforms expanded rapidly, supported by evidence showing comparable outcomes to in-person care for many conditions. For underserved communities, virtual mental health services have become a critical lifeline. Chronic disease management has also been reshaped by virtual care. Conditions such as diabetes, hypertension, heart failure, and asthma require ongoing monitoring and frequent adjustments rather than episodic visits. Remote patient monitoring devices, including glucose sensors, blood pressure cuffs, and wearable trackers, allow clinicians to receive real-time data and intervene earlier when problems arise. In the U.S., these tools have supported value-based care models by reducing hospitalizations and emergency department visits, while empowering patients to take a more active role in managing their health. The evolution of telehealth has also influenced the business and competitive landscape of American healthcare. Traditional health systems are no longer the only players. Technology companies, retail clinics, insurers, and venture-backed startups have entered the virtual care space, offering direct-to-consumer services that emphasize convenience, transparency, and speed. Virtual-first primary care models, online urgent care, and subscription-based telehealth services challenge conventional notions of where and how care occurs. This competition has pushed established providers to innovate, improve digital experiences, and rethink patient engagement strategies. Despite its progress, telehealth's evolution has exposed persistent challenges and inequities. The digital divide remains a significant issue in the United States. Reliable broadband access, affordable devices, and digital literacy are unevenly distributed across rural areas, low-income communities, older adults, and some minority populations. Without deliberate policy and investment, virtual care risks exacerbating existing health disparities rather than reducing them. Addressing these gaps requires coordinated efforts involving infrastructure development, community outreach, user-centered design, and alternative modalities such as audio-only visits when appropriate. Regulation and reimbursement continue to shape the trajectory of virtual care. Choose. While many pandemic-era flexibilities have been extended, others remain temporary or vary by payer and state. Providers must navigate complex rules around licensure, prescribing, privacy, and payment, which can hinder innovation and scalability in the U.S. Long-term sustainability of telehealth depends on establishing clear, consistent policies that balance access, quality, safety, and cost control. The shift from fee-for-service toward value-based care may further accelerate virtual care adoption by rewarding outcomes rather than visit volume. Quality and safety have become central to discussions about telehealth's future. Early skepticism questioned whether virtual visits could match the diagnostic accuracy and therapeutic effectiveness of in-person care. Over time, research and real-world experience have shown that when used appropriately, telehealth can deliver high-quality outcomes. However, it is not suitable for all clinical scenarios. The evolution of virtual care increasingly emphasizes hybrid models, where digital and in-person services are integrated seamlessly. In these models, patients may begin with a virtual visit, receive remote monitoring, and transition to in-person care when physical examination or procedures are necessary. Technology continues to drive the next phase of telehealth evolution. Artificial intelligence and machine learning are being incorporated into triage systems, clinical decision support, and patient engagement tools. Chatbots and virtual assistants can handle routine questions, appointment scheduling, and symptom checks, freeing clinicians to focus on more complex tasks. Advanced analytics enable personalized care plans and predictive modeling, helping identify patients at risk before conditions worsen. Before conditions worsen. These innovations raise important questions about data privacy, algorithmic bias, and the role of human judgment in care delivery. Patient expectations are also evolving alongside technology. American consumers increasingly view healthcare through the lens of service experience, comparing it to other digital interactions in their lives. They expect convenience, responsiveness, transparency, and choice. Telehealth meets many of these expectations but also raises new demands for usability, continuity, and trust. Successful virtual care models prioritize clear communication, cultural competence, and strong patient-provider relationships even when interactions occur through a screen. Looking ahead, the evolution of telehealth and virtual care in the United States is likely to continue along a path of integration rather than replacement. Virtual care will not eliminate hospitals, clinics, or face-to-face medicine, but it will redefine their roles. Healthcare delivery will become more distributed, moving beyond traditional settings into homes, workplaces, and communities. This shift has implications for workforce training, care coordination, and health system design. Clinicians will need new skills in digital communication, remote assessment, and technology-enabled teamwork. Ultimately, telehealth's evolution reflects broader changes in American society and healthcare priorities. An aging population, rising chronic disease burden, workforce shortages, and escalating costs demand new approaches to care delivery. Virtual care offers tools to address these challenges, but its success depends on thoughtful implementation, equitable access, and ongoing evaluation. As telehealth matures from an emergency solution into a standard mode of care, its greatest impact may lie not in technology itself, but in how it enables a more flexible, patient-centered, and resilient healthcare system for the United States.